I said, reach my brothers and sisters, take control of your life. Exercise 3 times a week, it's smart and join the fight. I said, move that body, work that body, exercise till you sweat.
My name is Shade Kosoko Lasaki. I'm the principal investigator on the REACH grant. REACH stands for Racial and Ethnic Approach to Community Health. We know that the commonest cause of death in African Americans in Omaha is cardiovascular disease, heart disease. When we look at the reasons why individuals are dying disproportionately, lack of physical activity, smoking, and obesity tends to stand out very clearly in our minds. Creighton University, in partnership with community members, was set out to get this work done. So our partners are individuals who we have worked closely with at a Center for Promoting Health and Health Equity at Creighton University. These partners include Charles Drew Health Center, the Department of Health, Doris Lassiter LLC, and the Omaha Housing Authority.
So when we began the REACH program, we had 3 goals in mind. Number 1, we wanted to increase the opportunity for the African American population to participate in physical activity. So we created walking trails at each of our partners' organizations that include internal and external walking trails. And then we also developed trails throughout the community that were destination points in which people could walk in 1-mile increments. Secondly, we wanted to bombard or saturate the community with messages about chronic disease and the value of participating in physical activity. And the message was that, get healthy, get wealthy. The formula is clear. Exercise 3 times a week and have no fear. The other thing we did was to create a physical activity day called Let's Move, Let's Reach. We had games, we had Zumba, we had dance, we had entertainment, and it was a real fun day, and the population liked it, and we plan to do that every year.
So I'm a cardiologist, a cardiovascular medicine specialist, and physical activity and promotion of exercise is something that I've been passionate about for decades. People have fewer heart attacks, they live longer, and it improves outcomes with cancer and other conditions, helps weight control across the board, helps blood pressure control or prevention of hypertension.
So, facilitated by Creighton University School of Medicine and the Douglas County Health Department, CPHHE-REACH set out to implement a Train the Trainer leadership program. And as of today, we have 56 trained and certified health ambassadors.
When individuals maintain a healthy lifestyle, they're generally more productive at work. They tend to have a more positive disposition. They tend to have a reduced level of stress. And so all those factors contribute to improved quality of life.
That the REACH program has allowed me to be able to do is help me to see, first of all, in our community, we have a lot of students who are hands-on to be able to talk about the benefits of the REACH program, to be able to be an example of what it can do for a person like me is valuable.
So this is the first time where we really have the resources and the commitment of the community to address physical activity.
And so what REACH allowed us to do is to really start with our employees. Okay, what are we doing? Are we offering Zumba classes? Do we have a walking trail that our employees can go out and map out?
Churches are the largest African American organization in the state of Nebraska. So we have a role to play. Rather than outreach, we in-reach into our own congregations and reach more people. And REACH is only one vehicle in which we can do that.
The ambassadors thought it would be nice to beautify the stairwells so people feel encouraged and want to take the stairs versus taking the elevators. And we found that the activity has increased. It's also helped as it relates to keeping down unwanted activity in those stairwells. So we've just seen an improvement as it relates to the property, as well as some of the morale in each one of those buildings.
The REACH program itself is a really large initiative. And as we continue to move forward, we're constantly looking for new and more innovative ways to increase that impact and reach more community members and the general public.
Or we employed a concept called systematic aggregation. Systematic aggregation is all of the community partners reporting to us on a regular basis and us taking that information and summing it up, totaling it up. What the results show now is that through this REACH program, what we've done is we've actually begun the process of changing the landscape of physical activities in the North Omaha community.
We have no choice but to sustain it because of the issues that are going on in this country. We need to work alongside the healthcare systems, the hospitals, the community health centers.
You kind of look at this program and you say, hey, it was a 3-year period for which we were operating this. This will go far beyond the time of the grant. And again, you're talking about changing lives and changing communities as you do so.
The healthier our workforce, the less in terms of our cost and our premiums. But more importantly, I think, is the fact that we want to make sure that we have a healthy workforce.
And the improvement and the impact that it's having within those towers. And we found that it's been very good and something that we want to keep going beyond the extent of the grant.
I think what you see is some partners who are really excited about this opportunity and having come around the table and saying, how can we address this and how can we make a difference in our community?
Since I've been participating in the REACH program, I've lost over 30 pounds. Blood pressure's down. My doctor told me that I'm doing real good. Cholesterol levels down. I've just been blessed with this program. It's taught me how to better myself, you know, so I can be around to see my grandkids grow up. And I couldn't ask for no more than that.
2 years ago, I had quadruple artery bypass surgery. And by me expressing that to the other people in the building, we have a program to where we do video dancing, chair exercises, and we also have walking throughout the building. I express myself to everybody, please go to your doctor, get plenty of exercise, do what needs to be done in order to stay healthy.
I've personally lost 20 pounds and it's been a great way to keep active. Number 2, it has been great in terms of health. It's actually made me look at my diet better. And so overall, stay active, be healthy, be engaged, and thank you REACH program for what you've done for our community.
We have had a successful program funded by the Center for Disease Control. We have impacted the lives of over 46,000 individuals in Omaha. More people now exercise every day. Individuals have reported that they have less visits to the doctor's office. And for those that are still having their chronic diseases, they have reported that their doctors have said they have improved.
Heart disease, obesity, and stroke. Get serious about your life, you got one, it's no joke. Now here's the deal, let's keep it real, it's a scientific fact. Keep it moving, keep it grooving, go forward and don't go back. Hey, get healthy, get wealthy,